Nadelmann. Dr. Nadelmann is the founder and executive director of the Drug Policy Alliance, the leading organization in the U.S. promoting alternatives to the war on drugs. Dr. Nadelmann.
Well, thank you, Senator Johnson, for initiating this roundtable and for inviting me. I've been waiting for the opportunity for a long time to share some of my thoughts with members of the U.S. Senate. Let me just be frank. I fundamentally believe that the war on drugs in this country and around the world has been a monumental disaster. It's been a disaster in public health terms. It's been a disaster in public safety terms. It's been a disaster in fiscal terms. It's been a disaster in human rights terms, right? I appreciate you bringing up the analogy to alcohol prohibition before, because, you know, you look back at alcohol prohibition. Some of what led the nation to embrace the 18th Amendment back then was the notion that alcohol was a horrific drug that was causing immense devastation in this country and what have you. And people embarked upon the experiment of national prohibition. What happened? We saw Al Capone and rising levels of organized crime. We saw all sorts of violence and bootleggers at the borders with Canada and Mexico and all around the country. We saw overflowing jail cells and courthouses. We saw hundreds of thousands of Americans being blinded and poisoned and killed by bad bootleg liquor that was more dangerous because it was illegal. We saw people talking about, you know, nullifying elements of the Bill of Rights of the U.S. Constitution. We saw levels of corruption that were unparalleled in many parts of the country. You know, we saw Chicago and other towns essentially taken over by the narco traffickers of the day, the alcohol bootleggers, and we saw a rising level of cynicism and disregard for the law. You know what else we saw? We didn't see any reduction in alcohol consumption. At the beginning, it looked like it was going to drive down alcohol use, but by the end of alcohol prohibition, alcohol use was as high at the end of alcohol prohibition as it had been at the beginning. And the major switch was that people had shifted from beer and wine to hard liquor, oftentimes underground hard liquor that was more dangerous. That's why the country came to its senses and said, enough of this, we're repealing alcohol prohibition. At the same time, many countries in Europe that were flirting with prohibition, they looked at us, they saw Al Capone, they saw all the money going down the drain, all the failures, all the hypocrisy. They said, we're not going to do that. We're going to crack down on booze with higher taxes and tougher licensing restrictions and public education campaigns. You know what happened in Europe with that? Without prohibiting alcohol, they drove down alcohol use and alcohol abuse further than we did at the beginning of alcohol prohibition in the United States. And rather than putting billions of pounds and guilders or whatever it might be into the hands of traffickers and gangsters, they put it into government treasuries. Seems to me that was the better approach then. There's a lot to be learned. Fast forward to right now, drug prohibition has been a monumental disaster. You mentioned, you know, what's going on in Mexico and places like that. Afghanistan, was going on in Colombia, parts of Central America. They are like Al Capone in Chicago times 50. It's a result of a failed prohibitionist policy. Then you look at what's happened in American prisons. What are we, less than 5% of the world's population, but almost 25% of the world's incarcerated populations, the highest rate of incarceration in the history of democratic societies, a rate of incarcerating black people in this country that puts South Africa during apartheid or the Soviet gulags to shame. It's nothing to be proud of, and it turned out to be remarkably ineffective in dealing with the problems of drug abuse. Then you look at the public health side. You know, though when HIV started to spread among injecting drug users back in the 1980s, those countries, not just Australia and the Netherlands, but Margaret Thatcher's Britain, decided that needle exchange programs were the right thing to do. They succeeded in keeping their HIV rates among injecting drug users under 5%. In America, we said, no way, no way, no way, and we ended up killing 100 to 200,000 people in this country, not just injecting drug users, but their lovers and their kids. That was a disaster as well. So I think that this war on drugs has just served this country so poorly. I think what happened is we developed an addiction. It was an addiction to drug war thinking, drug war ideology, and drug war policies. And right now, finally, thankfully, the country is finally in recovery from the drug war addiction of our past. Now, that said, in making the analogy to alcohol prohibition, I think it applies mightily to the issue of marijuana prohibition. And if I'd been coaching that 7-year-old who asked you that question that day that you spoke in that school, I would have said, you know, Senator, let me tell you something. During marijuana, I don't see any evidence that the marijuana laws are preventing young people from getting it or any evidence of preventing older people from getting it. All I see is evidence that it's putting a lot of people in jail and costing the government a lot of money. Do you still support a marijuana prohibition policy knowing that it's been totally ineffective? But with the other drugs, I think this is the way to think about it. And I'm going to conclude my comments with this. I think the best drug policy, what it tries to do is it starts with the understanding that there's never been a drug-free society, more or less in human history, and there's never going to be a drug-free society. If anything, we're going to see more drugs, legal, illegal, in between, gray market in the future, from pharmaceutical companies, underground manufacturers, you name it. Therefore, our challenge is not to try to keep drugs at bay, to build a wall or a moat between this country and others, between our schools and what have you. That's failed. The evidence is in. What we have to do is accept the fact, sadly, that drugs are here to stay, and that our great challenge is to learn how to live with them, so they cause the least possible harm and in some cases the greatest possible good. Therefore, think about drug policy in the two following ways. The first is that the optimal drug policy should try to do two things. It should seek to reduce the negative consequences of drug use, the death, the disease, the crime, and the suffering, the devastation of families and individuals and communities. It should seek to reduce the harms of drugs. And secondly, it must seek to reduce the harms of government policies, reduce the mass incarceration and the drug gangs out abroad and all of the negative health consequences and violations of civil liberties and human rights. The optimal drug policy is the one that most successfully reduces both the harms of drugs and the harms of government policies. And the second frame, and I'll finish with this, I think it's helpful, because all change essentially is incremental in these areas and most others, is to think about our options as a rate along a spectrum. From the most punitive drug policies on the one hand, the Saudi Arabia, Singapore, Malaysia, cut off your hands, execute you, lock them up, drug test you without cause, and throw you into what are called treatment camps, they're really prisons, all the way down to the most free market, Milton Friedman-esque, policies with no restrictions except, to keep kids away. The way we need to think about drug policy is moving down this spectrum, from the highly punitive over-reliance on the criminal law and the criminal justice institutions, moving incrementally, step by step, down this spectrum, but stopping short at the point at which going any further would actually entail real risk to public health or public safety. And it means being driven by the evidence of the sort that Dr. McDonald just referenced to. When the evidence shows that mandatory minimum sentences are not having an effective deterrent impact, then it's time to reform or to repeal those. When the evidence shows that marijuana has useful medical purposes, it's time to acknowledge that. When the evidence shows that providing sterile syringes to injecting drug users through pharmacies or needle exchange programs reduces the spread of HIV/AIDS and Hep C without increasing drug use, it's time to do that. When the evidence shows that methadone maintenance and buprenorphine maintenance are successful in reducing the harms of addiction and helping people get their lives together, it's time to do that. When the evidence shows that heroin maintenance and safe injection sites reduce all sorts of harms and produce a net benefit, it's time to do that. With marijuana legalization, we'll see. My judgment is that the net benefits of moving the direction of the sensible regulation of marijuana exceed the risks. That's a judgment, and we'll see how that works out, but I think that the evidence overwhelmingly suggests the right way to go. With the other drugs, we need to move towards a decriminalization, public health approach, and focus, and this is what I'll do in my comments later, on reducing the demand and the magnitude for demand in these drugs. So long as there is a demand, there will be a supply. Pouring money into supply just pushes it from one place to another, like trying to bang down on mercury or step down on a balloon. It's about reducing demand in ways that are driven by the evidence and respect for basic human decency. Thank you.
Thank you, Dr. Nadelmann. Now for a slightly different perspective, Dr. David Murray served nearly 13 years in the Bush and Obama administration as Chief Scientist and Associate Director of Supply Reduction in the White House Office of National Drug Control Policy. He's currently Senior Fellow at the Hudson Institute. Dr. Murray.
Thank you, Senator. And I certainly want to take a moment to give my appreciation for each of you who is persisting in this issue and this problem. It is an urgent issue, and it does not get the attention it deserves. And I want to commend you, senators, who have persisted in careful attention to this issue and are probing for answers for what is, as you identified, the cause of 47,000 deaths of Americans a year and overwhelming morbidity that is an additional toll. My perspective, for having worked inside the government and looking at the biomedical literature, is that we need to approach drug policy somewhat differently than we have most recently, but that it can work, that we can save lives, and that we can effectively transition people into more secure and better lives. The underlying role of substance abuse, of drug use in driving American pathologies is extraordinary, from homelessness to domestic violence to law enforcement difficulties to national security risks to educational failure. to the death of our beloved fellow citizens and family members. This is an extraordinary cancer that has been eating at us for a long time. You will hear arguments, and have heard some of them already, that I will be probably an outlier, a resistor with regard to certain of the claims. It's not so much I don't share the goals of lower drug use, of a safer, healthier society. It's that I'm not convinced that the evidence is as strong as it is sometimes portrayed for these methodologies that are sometimes referred to as harm reduction. There are claims made about impact that when you look more carefully, the evidence is actually very weak.